Hello everyone. Today's video is a Q&A video talking about things like MARCoNS and nasal sprays and bacterial vaginosis and some other stuff too. So we'll just get right into it. Just before starting the video though, if you don't mind taking a quick moment to please like, share, subscribe, and or post a quick comment on the video, I'd really appreciate it. So thanks in advance for taking a second to do that. And as per usual, nothing I'm saying should be construed as medical advice. This is for informational purposes only. If you need medical advice, please ask your healthcare provider for that advice. So the first question says, can you talk about EDTA, gentamicin, and itraconazole spray in a nasal rinse? A lot of people mention sprays, but I was given a rinse and my doctor isn't really clear why or what to expect. I am on day 3 and it feels like I'm losing my voice and have drainage all day. My MARCoNS swab said my biofilms were weak, so it will only take 6 weeks like my doctor so will it take only 6 weeks like my doctor mentioned? Because everyone else seems to say there is no way it'll be that quick. Thanks for your videos. They help so much. You're welcome. Thanks for the thanks. So I appreciate the question. So when it comes to test results looking at MARCoNS and looking at biofilms, what I found in my practice and what I've also heard from colleagues as well, including some experts in the field, folks that are lecture at the conferences where we talk about things like mold and biofilms and chronic infections and different things like that. I won't name names because I'm not here to speak for anyone else, but some very, very smart docs out there that are fairly well known in these areas. There are a lot of us who have found that these types of nasal swab test results can be not entirely linear. And what I mean by that is sometimes you'll get a swab back and it'll say, there's this and this, there's MARCoNS, there's biofilms, and there's high levels of this, high levels of that, and then you'll treat for a while and then the levels will be nice and low, or they'll be lower, and then you'll treat for a while and then you'll swab again and then see the levels are high again. It's like, oh, what's happening here? Oh, it must be, biofilms or this or that, things are coming out of the woodwork, and but then you treat for a while and they're lower and then they're higher again, and it can be yo-yoing. And I've had some patients over time where they're kind of chasing these results for, sometimes the better part of a couple of years, sometimes a bit longer. And there's some of us who just don't really, trying to think of the most diplomatic way of phrasing this, but basically don't really put 100% stock in that type of testing, or I should say, don't rely on that testing to decide what to do next with respect to a nasal spray or treating for mold or whatnot, or MARCoNS. There's also those of us out there that are just not 100% sure exactly how important it is to treat until MARCoNS is totally gone on follow-up test results. And anyways, I think I've had some other videos where I've gotten into that in more detail, so feel free to keyword search my name and MARCoNS in YouTube and probably find those videos there. So I won't reiterate that here, but just for context, there's just some questions around how important it is to sort of be led by those results, so to speak. So in my practice, I tend to follow symptoms and treatment response more than I would be following test results for nasal culture, for what it's worth. As far as the using a nasal spray versus a nasal rinse, I don't have, aside from folks using neti pots, which can be very helpful to help reduce inflammation and sinus symptoms and things like that. As far as using a nasal rinse to kill mold and MARCoNS and other bacteria and yeast and things like that in the sinuses, I really don't have any experience using those. I do have not much. I never recommend them, and I have had patients who have been using them. I'll say, oh yeah, been doing a nasal rinse and I'm putting in some golden seal or some essential oils or whatever, and ask them, okay, well, how much are you putting in there? And so then I'm a bit of a nerdy guy. I enjoy math maybe more than the average bear out there, maybe not as much as a mathematician, but I do enjoy doing calculations on things. And so in many of those cases, patients will come in and they're like, oh yeah, I'm putting in a teaspoon of that and this and that, and my 100 milliliters or 200 milliliters of saline that I'm rinsing with. And we do the calculation, we see it is a much, much, much lower concentration in the grand scheme of things than the nasal spray, say, that I'm recommending, like a diluted frankincense nasal spray or silver nasal spray or something like that. So just when we're thinking about two things. One is, what is the actual concentration that's in the final solution that we're administering one way or the other? But then also, how long is that solution going to be coming into contact with those nasal passages? The way I think about a nasal spray is that I'm spraying it up there and then I'm just leaving it in there. It's not, running in one nostril and out the other. It's actually going to linger in there. So I'm leaving a residue behind, and I can administer that as many times a day as I feel like I need to. Whereas if I'm doing, a big rinse, once a day or twice a day, it's just not going to linger in there necessarily. Yes, there will be some residue left behind, but it also is a rinse going to get as high up into the nasal passages as a spray. So these are just some of the questions that I would ask. So I have very limited experience with nasal rinses, but those are just some of the questions that I would be thinking if a patient asked me about that directly in my practice. As far as taking 6 weeks to resolve an issue, like again, whereas my MARCoNS swabs said my biofilms were weak, so will it only take 6 weeks? I mean, maybe. And if your doctor has experience with this and says, yeah, this is what it usually takes, then fantastic. Again, like I just take the results from these nasal swabs with, I don't want to downplay them too much, but I do take them with a bit of a grain of salt, because the results can be so yo-yo-y from one time to the other. Sometimes they do follow a linear pattern, don't get me wrong, but just oftentimes they don't, in my experience at least, and that's why I'm saying what I'm saying. So I hope that this information was helpful, and I will move on to the next question here. I always think I'm going to answer these questions faster than I do, and it's like, oh my gosh, I'm already getting on in time here. So the next question is, I just had a nasal culture from a lab called MicroDX, and no MARCoNS, but I do have large Staph aureus, and then it gets a little bit autocorrecty here, I think. Can I take an antibiotic for this and be done with a year of nasal congestion after my mold event? So thanks for the question. So everything I just said about, nasal cultures and all that, I stand by that with this answer as well. I mean, when there's nasal congestion for a year following a mold exposure, an antibiotic, and Staph aureus coming up on test results, an antibiotic, depending on what it is, might be really successful if all that's left is bacteria, just the Staph aureus. But if there's mold still there as well, or some concomitant yeast, for example, then an antibiotic might not really do a blessed thing. I've had so many patients over the years, even before I got steeped into the mold illness world, I knew from experience that so many of my patients with chronic sinus issues would come in saying, yeah, I've been treated with so many antibiotics and all of this, and I still have these chronic sinus issues, and I would treat them for yeast, and they would get better in many cases, even just with oral treatments for yeast. Then I ran into enough difficult cases over time where I learned, okay, we really need to use nasal sprays and things like that in a lot of cases as well. In my experience, what I usually prefer to recommend is essential oil, diluted essential oil nasal sprays, typically frankincense essential oil, because it's just so broad spectrum, and whether my patient has Staph aureus, whether they have mold, whether they have yeast, all of the above, then I feel very confident in many of those cases that we're going to be able to hit all of those targets and then some with essential oils. But antibiotics, depending on the antibiotic, can be a bit more of a one-trick pony. And then the very last question here on a different topic, but it mentioned the word biofilm, so I thought it kind of fit, is that I get bacterial vaginosis. Basically, the patient this individual rather says they get bacterial vaginosis from intercourse, and every time this happens, they take metronidazole and it clears the BV, but then it comes right back the next time they're sexually active, unfortunately. And then the specific question is, what is the difference between biofilm and urea plasma? So biofilms are the hiding places for the microbes. Urea plasma is a type of bacterial infection. So that's the answer to the question. I did want to quickly mention here, though, that when there is this type of pattern that happens, it can be a big indication that there's an issue with the vaginal microbiome. Again, I'm not giving any specific advice for this case, but just as a point of interest here, it can be an indication of basically a dysbiosis in the vaginal canal. And in a lot of patients that I've worked with, ozonated oil suppositories can be really helpful. I have a video on that pretty easy to search that on YouTube, and it talks about that in more detail. So I just kind of wanted to mention that quickly because it's such a awful thing when this happens and to folks, and it can just be a very, very successful solution in many of the cases I've treated, at least. So thank you for the questions as always. If you have other questions, just post it in the comment section below. I'll do my best to answer as soon as I can.